In February 1964, President Lyndon B. Johnson launched the first American Heart Month. Since then, the field of cardiology has made significant advancement. Here to talk about the latest in heart care is Dr. Richard Kettlecamp, UnityPoint Health St. cardiologist. Dr. Kettlecamp, thanks for joining us here today.
Thanks for having me.
So tell us, describe the different cardiology specialties available today.
Yeah, sure. So it was probably about 40 years ago when the first cardiologist came to town. He was one of my partners. He's subsequently retired, and he was a general cardiologist, kind of jack of all trades. And as things have gotten more complicated, there's been lots of multi-specialty fields. There's general cardiology, which cardiologists will do, but oftentimes they're specializing in imaging or some other things. There's interventional cardiology, and those are the doctors who take care of blockages in the heart arteries. There's endovascular cardiologists who take care of blockages in the other arteries like the legs and the kidneys and so forth. There's structural cardiologists, and so they deal with holes in the heart, valves that aren't working properly, and a lot of these things can be done without open heart surgery now, which is a real advantage. And then there's electrophysiologists. So electrophysiology is the doctors who deal with electrical conduction issues of the heart, and lots of advances in that field. And then another example would be heart failure. Heart failure has become a very complicated area, so there's specialists who deal with just heart failure in general.
Yeah, lots of different categories.
Right.
And tell us, along with that, what new procedures are available?
Sure. There's a lot of what they call coronary procedures, which is the heart arteries. So people can have completely blocked arteries. The only way in the past to fix those was bypass surgery.
And there huge surgery, yeah.
Exactly. It's a big procedure. It's a routine procedure. They do very well with that. But if you want to avoid having, your sternum cut,
right.
A lot of times these things can be done without open heart surgery through a little catheter in the wrist. And so opening up a completely blocked artery was really just a territory where the surgeons, that was the only way to fix it, was bypass. So now we can do that without that. Heart valve procedures, something called TAVR, transcutaneous aortic valve replacement, where we can replace an aortic valve without opening up the chest with a little catheter in the leg. A lot of times we can fix mitral valves. Leaky mitral valves with what they call a clip procedure, mitral clip as an example, or even replace the valve with a catheter-based valve, again with a little incision in the leg. There's a new procedure called the Watchman, which will occlude what they call the left atrial appendage to prevent the need for anticoagulation in people who have irregular heart rhythms. Let's see, that's a number of them.
Right,
I'm
that
sure
is
there's
a lot.
many others.
Yeah, and what advice do you have for people to take care of their heart so maybe they don't have to get to that point?
Yeah, good point. A lot of things you can do for primary prevention. There's things we can't control. We can't control our age, we can't control what mom and dad gave us, right? But we can control the risk factors, which is heart, blood pressure, cholesterol, sugar diabetes. So, when your doc is prescribing these meds, it's important to take them, get your blood pressure down, get your blood sugars down, kind of know your numbers, what's my cholesterol level, that kind of thing. And then diet and exercise. Eating well, you occasionally need a slice of pizza, but if you can most of the time eat low carb, low fat, low cholesterol foods, that's good for you. And daily exercise. Ideally, we'd all do a half hour to 45 minutes of daily exercise. Moderate exercise, it doesn't have to be anything fancy. When the weather's good, get out and walk the neighborhood. Stationary bike when it's, lousy weather like it is now.
Right.
But generally speaking, just do it. And it's a matter of just scheduling it, right?
Yep.
20 minutes, 30 minutes every single day, same time, same day, so it becomes a habit.
All right, Dr. Kettlecamp, thanks for joining us.
Thank you. Thanks for having me.
And stay with TV9. We'll be right back.